I'm Asaki Matsuzaki, a psychiatrist.
Today's topic is about excessive sexual behavior. As a psychiatrist, dealing with excessive sexual behavior in clinical practice is something I rarely do. However, on rare occasions, I do encounter it as an issue. So let's take this opportunity to address it here to deepen my own understanding. In psychiatry and psychology, the term libido has traditionally been used as a concept referring to a fundamental human drive, particularly sexual energy. In recent years, however, it has become more common to describe it using terms such as sexual desire or sexual urges rather than libido. That said, libido can still be understood as one aspect of the basic energy that humans possess. For example, during adolescence, sexual interest increases, but that is not abnormal. Such experiences are likely an important chapter in human life.
However, sexual behavior can also be addressed as a problem in relation to various mental disorders.
For instance, in bipolar disorder, sexual desire may also increase during manic episodes. When an increase in sexual desire is observed, it is important to be aware of the possibility of a manic state. However, a manic episode should not be diagnosed based solely on heightened sexual desire. In mania, not only sexual desire but also motivation, mood, and various other symptoms are expected to increase and appear at the same time. Also, in individuals with borderline personality disorder, sexual problems can occur. A common issue is sexually deviant behavior, namely engaging in sexual relationships with multiple partners or having sexual encounters without adequate consideration for safety. However, such sexual behavior is thought to arise not so much from heightened sexual desire itself as from difficulty with self-control. It is more appropriate to understand it as sexual behavior appearing as one form of impulsive behavior.
Moreover, it has been pointed out that in post-traumatic stress disorder, PTSD, some individuals show an increase in sexual behavior. People with PTSD, in order to distract themselves from painful trauma, may resort to sexual behavior as a way of coping. Additionally, in people with PTSD, because of trauma, vasopressin and oxytocin undergo changes, as is often said. People with PTSD, because of trauma, are thought to become more easily sexually aroused, while at the same time finding it difficult to gain satisfaction from sexual activity.
As a result, they are believed to repeatedly engage in sexual behavior in an attempt to fill this lack of satisfaction. Also, among people with dementia, there are some who engage in sexually inappropriate behavior. This can often become a significant problem for caregivers. In some cases, people with dementia may have increased sexual desire, but this is rare. In most cases, sexually inappropriate behavior reflects a misplaced expression of a desire for affection or to result from disinhibition. That is, a weakening of the function that suppresses behavior as is thought. Now, when excessive sexual behavior is observed on its own, without other psychiatric symptoms, there are several ways to think about it.
One perspective is to consider sexual desire itself to be pathologically heightened. The concept known as hypersexuality.
However, this is still a matter of debate and has not been established as an independent diagnostic category.
Another view sees excessive sexual behavior as a disorder of the ability to control impulses,
namely an impulse control disorder.
Furthermore, the concept of sexual addiction is also widely known. Similar to alcohol or drug addiction, this is understood as a dependence on specific sexual behaviors.
And there is also the concept of compulsive sexual behavior disorder, which is considered to be part of the bipolar spectrum. Thus, even when we talk about excessive sexual behavior, it is thought that various different factors may underlie it.
I suppose so. I feel like my thoughts have become a bit more organized. Well, I guess my perspective has broadened as well. All right.
That's all for today. Hey,